Welcome to the show that brings the living experiences of black men in the UK in a dialogue of equals with health professionals from the NHS and community advocates to reduce health inequalities affecting our communities.
Me and my unks had a dialogue of equals. We're tired of all our people dying before they seem to. Silence don't make you peaceful. So many open wounds, don't even know how we'll heal all. But this is food for thought of a meal. It might be a free course.
I'm Michael Morgan.
And I'm Stafford Scott, and I'd like to welcome you and introduce you to the second episode of our podcast, A Dialogue of Equals, Black Men in Conversation with the NHS. And
Indeed.
we are the black men, and we're representing for black men. And this particular episode is about the weathering effects of racism on black men's health. We call it a life course approach. Now, for people out there that may sound like a mouthful, for me it sounds like a mouthful. I first started to understand this issue of weathering when I brought over Joy DeGroy in 2000. Actually, we brought her a few times. And Joy DeGroy, in talking about post-traumatic slave syndrome, started to say that the medical profession was finally catching up with some of her theories. So one of the theories that she was promoting at the time, and this is the last time she came was 2011, was around the impact of post-traumatic slave syndrome on all people born in the Caribbean and obviously people in Africa and such, those who had endured colonialism and imperialism, that impact, the impact of racism on the body. And what she spoke about at the time was how it impacted and it affected the cortisol levels, and that the cortisol levels would then affect metabolism. At the time when she said it, I wasn't clear what that would then play out and mean. But what we're starting to understand now is that cortisol can lead to weight gain, it leads to hypertension, it leads to muscle weakness, osteoporosis. The main one is diabetes type 2. So the NHS often tells us that because of the color of our skin, because of our ethnicity, we're more likely to get diabetes type 2. But we now know and realize that it's not about the color of our skin. It's about what we experience when living in our skin.
I'm intrigued though, why is it weathering and why not erosion? Because they both effectively do chip away at you, do work away at you, do wear you down.
I imagine that's it's just terminology. And weathering, both of them are the same, but weathering gives that, implies a wearing down over a long period of time. And that's why in this session, we're calling it weathering, effects of racism on black man's health, a life course approach, because it's something that impacts on us over a lifetime.
Okay.
And with that, I'd like to introduce our guests, and I'll start off today with, I'm really pleased to have Lynette here, Lynette Charles, who is the CEO of Mind Haringey and also Haringey Black Thrive. Is it Haringey Black Thrive or Black Thrive?
Black Thrive Haringey.
Black Thrive Haringey. As long as we're thriving, that's absolutely the key. And welcome, really pleased to have you here today, Lynette. Once again, we have Professor Habib Navqi, Professor Health Inequity from the Race Health Observatory. And again, really pleased and chuffed to have Patrick Vernon, social commentator, historian, and health advocate on the panel today. Right. So, in opening it up,
I first of all just wanted to thank Lynette. Lynette, online, I noticed that mental health charities were very, very keen to stay away from the issue of what happened around Chris Carver, but Mind went charging in there and they recognized that they needed to support those who are actually living with not just what he went through, but the aftermath. And I wanted to commend Mind as the only ones who stood, shoulder to shoulder with the Black community, but more importantly, put their head above the parapet. Because what we're going to be talking about today, this kind of reflects that weathering in terms of wearing people down by the virtue of the fact that they are living through racism. So thank you for that. How important, I mean, just on that and just sticking with the topic, today's discussion, weathering, how important was that in terms of your thought or mind's thought, getting that out there, getting amongst the people and showing support?
I think that Mind's been on a huge journey. It's an organisation that has been around for 75 years. And actually, when I came to Mind probably about 10 years ago, as CEO of Mind in Haringey, I would say that generally the community in Haringey felt that Mind was a very white, middle-class organisation. So what my role has been in Haringey is to listen to what the community is saying and then show them that we are there to address some of the inequalities and to speak up for the Black community in Haringey, because we are disproportionate when we look at things like serious mental illness in Haringey. And hopefully some of us that run the local Minds, because Mind is a federated charity model, we have influenced Mind to think about how it relates to the Black community and how it supports some of the injustices that we know go on in our communities. So I would say that Mind's still on that journey and still needs to show evidence of its support to the Black community, particularly in mental health, because again, our outcomes are poor and we are disproportionately affected, particularly by the part of the mental health system where people's liberties are taken away. So I would say that Mind's on a big journey, but I'm glad to hear that parts of the community felt that we were reaching out and speaking up for that injustice.
Absolutely. And in terms of what you said there, underpinning, the fact that the Black community did feel supported, on the opposite end of the spectrum, there were those who thought that Mind was speaking out of turn. What sort of, I didn't really see it clearly defined online, but again, just sticking with, the effects of weathering, we know what this means. We know the long-term effects. We know the long-term erosion. But there were those in the wider community who didn't feel as though this needed to be an approach by Mind. What would you say to somebody who was watching, who was of that opinion too?
I would say that Mind made a commitment to be anti-racist. So if you're going to be anti-racist, you have to speak out against injustices where you see them. There is no point in saying that you're going to be anti-racist, but it's just a strategy that is in a cupboard somewhere. So if you're really going to be anti-racist, you need to be an ally. You need to not wait for the Black community to always have to raise their concerns when things like this happen in their community. But we need our white allies to speak up, because it is those people that are actually part of the system that we are trying to dismantle so that we've got a fairer system for the Black community and others. I truly believe if we get it right for the Black community, we will get it right for all people who face inequalities in our current health system.
I wonder, Habib, the health of Black men as a population in the UK, in our mind, is a public health issue. But it gets dismissed as the outcome of individual choices. What can you say to that?
Well, I think there's a couple of things there. Firstly, it's not just about people's choices. Because there's no hard to reach community. It's about how do institutions, healthcare system go out and reach those communities and design their systems, their policies, their processes, their ways of working in a way that's inclusive. That nobody is left behind in some of the interventions that they roll out, and in fact those interventions should be co-produced in the first place, so that when they are rolled out in collaboration, in partnership with other organizations, they have the best chance of being effective. And so it's about how do we engage, and it's about engagement with communities. And perhaps the NHS has been somewhat guilty in the past of having piecemeal engagement with communities and not engagement that's sustained and meaningful over time. And that's a shift that we need within our healthcare system, so that actually we do get consultation, engagement, co-production with communities that's meaningful and has a long-term positive impact upon some of the challenges that we want to shift the dialogue.
Absolutely.
Patrick, I'm intrigued in terms of this notion of being hard to reach. I do hear that so many times in relation to the NHS, and they talk about hard to reach communities. Am I right in thinking that perhaps this is a way in which to throw up a barrier in terms of access to healthcare that is intentional? Because it certainly feels that way. It certainly feels as a cyclical phrase that I keep hearing, hard to reach. I've heard that in the 90s. I've heard that in the 80s. I'm hearing it in the noughties now.
Well, I think the question changes. People use the word seldom heard. I'm not sure the latest jargon is. But when it comes to police, we're never hard to reach, let's face it. You know what I mean? In non-revenue, never hard to reach. You know, KC, we're never hard to reach, you know what I mean?
So it only with the NHS, in some sense, that's victim blaming, right? Blaming the victims for the inadequacies of the system.
Well, yeah, I think it's how you see the world be around health. So if wealth is an individual life choice decision and you're not taking responsibility, it's your fault. Your fault you got cancer. Your fault you got diabetes. It's your fault you got everything. And there might be elements of that because we know that a certain prognosis is very complicated and different like that. But I think but at the same time, we are taxpayers. We have contributed to the wealth and the economy of this nation for many, many centuries. So it's about making sure that services are inclusive, and all evidence base shown that if you make it inclusive, everyone benefits. If you make it exclusive, only the people who know the system, who know how to lobby and influence, get what they want. And I think comes to black men. Sometimes, on one level, we have a lot of bravado as men. We know what we want sometimes, don't we, guys? And other times we just take a back seat. And I think it's about empowering men, young men particularly, and even older men to do health checks, ask those questions. I mean, with women, they do it. They know instinctively if there's something wrong. I'm gonna see a doctor, get advice, see a third party. When it comes to black men, we're invincible. We're Superman. We can handle it. We can take it all that kind of stuff. So we have to change that mindset.
Can I add something to that? Because I actually think it's not just about a mindset. I think we got to deal with the distrust in the health system. I think often, and definitely in the mental health system, the reason that black men don't go to the system for support is that they see what has happened to other black men when they have sought support. And I think that that's got something to play. So we talk a lot about co-production, but we don't deal with some of the history and some of the reasons why some of those communities haven't gone to health services, and why we're not further on in that journey. It's not just about co-production. It is about allowing the community to support their community and skilling up the community so that they're not always knocking on the door of the same services that haven't really changed in about 30 years and still don't understand those communities. You can change terminology, you can call them seldom heard, hard to reach, but I think it's about understanding why there is distrust in the black community, and particularly with black men. I always think about black men as the victims of the systematic racism that exists in this country. And I think that is another reason that they don't go to the health service when they know that they need to.
I hear you there, but can I just, I suppose, give a personal anecdotal? No, I'll just come out and say it. I feel as Black men, we are terrible in coming forward and talking about the things that ail us and seeking help for it. I hear everything you say there, but recently this stuck in my mind as an example, and I just really want Sapper to come in on this because it related to a colleague, a friend, a contact of his when we were talking about prostrate. I mean, air quotes here, for those who are listening to this, for those watching obviously get it, but prostrate cancer. I just really want you to unpack that as an example of Black men not actually helping themselves.
And you know, with that brother, I said to him that he was being ignorant, and he got really upset when I said, he said, he got really upset when I said he was being ignorant. It was a Black man who, he actually does blogs and such, and he had done a blog telling Black men that he wasn't going to go and have the digital check for prostate cancer. And I had to say to him that he got it wrong on so many different levels, and that you shouldn't put out messages unless you're actually clear that the messaging that you're putting out actually is up to date. It's up to date, current, and is actually factual. But I do think that with Black men, what happens to us sometimes is the weight. I think what Lynette was saying is getting in that direction, and it flows with the weathering effect. It's the weight of a multiplicity of different oppressions coming from all of these different directions. So in a moment, Habib, I'm going to ask you to talk about the social determinants of health. Because again, I said that we learned some new language during COVID, and they started to talk about the social determinants of health. And in trying to understand that, this was ways of being able to explain that these social determinants, we are sometimes based on discrimination. So we get disproportionate treatment when it comes to income, social protection, education, unemployment, job insecurity, working life conditions, food insecurity, housing, basic amenities, the environment, early childhood development, structural conflict, and access to affordable health services of decent quality. And all of that together means that I think that we feel oppressed, and we then find reasons and excuses not to engage with those that we think represent those oppressive forces. So we find a myriad of ways to justify not going into a system that previously has victimized us, and also a system that ultimately we think just is victim blaming and blames us for the troubles that we have. And that's part of the reason why we're still talking as if we're in almost a different century. Why that thought process hasn't developed properly.
I hear you.
And I don't know how big if you can talk to this notion of the social determinants and how they impact on the health.
Sure. So, in fact, I'll take a different take on it. So, racism, we know, has a direct impact on health, both physical health and mental health as well. And we will talk about the weathering effect and how that plays out. And you also know that racism has an impact upon the social determinants of health. And that does include all of the things that you mentioned, Stafford, education, employment, housing, and the list goes on. And the inequalities and the racism that we see within those areas has a cumulative impact upon a person's health and across the life course, from birth, in fact, from pre-birth to end of life, and at critical points in between those two key milestones as well. So it's important that, I think in episode 1, we talked about the causes of the inequalities, and in fact, the social determinants of health are some of those, looking at those and the causes of those are the things that we need to focus on. And Professor Michael Marmot has done a lot of work around social determinants of health. And up until recently, he had 6 social determinants of health. And then more recently has added 2 new social determinants of health. Now there are 8. And those 2 new ones are the climate crisis is one. And the second one that's been added is racism. And so it's about looking at the holistic approach to tackling some of these challenges. The NHS, we're talking about the NHS, has a role to play in tackling these inequalities, but it cannot be the only enabler for equity. We need other systems, other parts of society to come together to tackle what essentially is a global system-wide challenge, i.e. racism, that requires a global and system-wide response.
Thank you, Patrick, do you want to comment?
Yeah, I think in terms of the social determinant, it's as you heard from a neighbour, Michael Marmot has added climate and racism, and actually, he's one of the leading thinkers. But even with Michael Marmot, it's taken a while to reach that journey himself, and that's part of the challenge. It's about the education. I think Michael Marmot now is seeing himself as an ally, I would say, and there's more and more public health consultants, doctors, researchers, academics. And, we still need more people. I think you've used the expression weathering. I used to use that expression quite a lot, but I have a different expression, Stafford. I use the expression sufferation. Because weathering or post-traumatic slave syndrome is embedded in African American history, thinking, whereas sufferation is a Caribbean thing. It's from Rastafari. When people use the word sufferation, you know what it means. The poverty, the discrimination, the colorism, all that kind of stuff. And then it fits, I think personally, it fits naturally in UK context because of our history of Windrush and everything else around. So when we say suffer, all the songs that we grew up on as kids, sufferation, suffering, always suffering, the sufferers. So I think that for the ordinary person on the street, they can identify more with sufferation than weathering. They probably think it's something to do with a meteorite, climate change, or I don't know, stuff like that maybe.
So the long-term effects of sufferation.
Yeah, and from enslavement. So, you mentioned about Joy. And if you remember, Stafford, we worked closely to get Joy to come over around in 2007. Around the time of the bicentenary 2nd anniversary of the end of the Slave Trade Act. And it's the only time that the Department of Health have organised an event recognising the history of enslavement and mental health. That's the only time. If I can remember, it was a big event. It was in Methodist Hall. There must have been about 500 people there. And it was a full house. We had a whole range of speakers and Joy was the main speaker. But can you remember who the government minister was at the time? And there was a government minister that was on the platform, and he's the only government minister I know responsibility for mental health and made the links between the history of enslavement and the mental health crisis that we're still experiencing. You can't remember his name. Ivan Lewis.
Ivan Lewis.
MP.
Lewis.
No longer MP. Got involved with other stuff. We won't go there right now. But anyway.
Yeah. Yeah. So we're starting to get a greater understanding, right? But the sufferation, what makes the sufferation even worse is the denial, right? So when we turn up and we talk about our experiences of the systems, the institutions, we talked about the social determinants and how that impacts on us. It's that constant denial within the system that I would imagine then has an even greater impact in terms of our physical and physiological way of dealing with that.
There's different ways of looking at that, but that's right in the sense that not acknowledging an issue means that there will not be interventions to tackle the issue. So the suffering will continue in that sense.
And denying our reality,
yes,
is going to give us mental health
yes,
issues to address somewhere down the line, I would imagine.
yes. And throughout the whole lifespan, we talk about life course approach. And in fact, your chronological age doesn't just capture how many years you've been on this planet. It also captures the cumulative impact of the suffering and the discrimination and the racism which builds on. In fact, the weathering concept is around the drip, the constant drip of water on even if it's a stone or a slab or concrete, over time that will become weathered. It will weigh down, you will get, and so that's exactly the impact that racism has on people, because it erodes your immune system in the sense of, if you get very technical, it's about your chromosomes, how they become smaller in size and lead to an individual becoming more susceptible to illness, essentially.
I'm quite interested in the fact that, excuse me, you've made reference to it twice, and that is the life course approach. But from a mental health approach and from a mental health point of view, what are the characteristics of this life course approach? What does this look like?
That's very interesting, because actually in mental health, when I think about children and adolescent mental health services, they're on their knees. So I don't know if we've got to this life course. And then when we think about women in a maternity situation, we still haven't got that right. So I'm not sure that we're at a point when we can talk about life course of health or mental health. I'm just thinking about what you said about weathering. So I don't think it's just the drip that we experience on a regular basis. I also think it's being part of a community where we're feeling that drip, but so is the rest of our community. So we can't see any hope anywhere. We share stories, and we're just sharing stories of our bad experiences. So there's a kind of collective weathering or sufferation that goes on. And then I would bring in as well those that are born in this country, because we talk a lot about, intergenerational trauma, etc. But can you actually imagine being born in a country where you are treated badly because the color of your skin, although, and you don't know if you should claim your identity as British? How that must feel. So I think, weathering isn't just an individual thing. It's a collective experience. It's worsened when you're actually born here because you're not accepted. And it almost feels worse. I think if I'd come from the Caribbean and I come over here and people were racist, I would think, well, I'm from somewhere else. But at least I can go back to those people and actually feel like I belong and I'm appreciated and they understand me. But can you imagine being born in a country where you got nowhere else to go but here? There's a collective weathering and sufferation that goes on for the people born in this country as well.
That's why it's expressive separation, isn't it?
Yeah, I think I'm agreeing with you, Patrick. It's more than weathering.
Me growing up as a teenager, you weren't really Jamaican or Caribbean. You weren't really British. Who were you? And that's why the Raspan movement in the 70s was big, because all my school friends, they were all lock stock. I was a soul boy, so I didn't lock stock. Where are you? Which side of you on? You're a soul boy reggae? No, I'm going to go right now. But you know what I mean? So a lot of guys locked stock because they were looking for that sense of belonging and identity, Rastafari. But many provided that. But unfortunately, what happened was that had a conflict with the family. Some people got kicked out of the homes. And then when people didn't get the jobs because they were just seen almost like alien and they got excluded from society. I'm going to create my own society. I'm going to create my own community. But unfortunately, when that had an interface with that, and I think that's when we had a massive explosion from the mid-70s up to now, of particularly black men, mainly Caribbean, but now increasingly from Africa, and also Muslim men who are seen as, obviously I saw that post in your office, Minister Society. Minister Society, all of you, you're miss, deal with you.
Being utterly, go being others, right? And that again adds to that sense of worry. I mean, thank you, Patrick. But what you said, Lynette, was really good. It's a group experience. There's this group dynamic that is there, right? And then lead to the stereotyping, the profiling, and everything else that we suffer and endure as a community out there. And it leads to us knowing it doesn't matter what we do as individuals, we're always going to be perceived and judged as groups. And I was really interested to know whether or not this notion of weathering is the same, say, on the continent of Africa as it might be in the UK and America. Are we just talking about weathering in countries where there's white majorities and black communities?
I think that's where most of the information and intelligence comes from. So when we look at, the concept can be translated into other parts of the globe. So if you think about indigenous populations, for example, where they've now become the minority group very often. So it's about looking at solutions in a collaborative way, and that's why within the NHS Race and Health Observatory we have an international experts group, which is co-chaired by Yvonne Coghill and Professor David Williams from Harvard. And what they've done, which is quite unique, is bring together race and health experts from New Zealand, Australia, South Africa, Guatemala, US and Canada, and of course the UK. And what all of those people have in common is this global separation or global weathering. And it's this concept of how racism plays out in health and healthcare, in your access and your experience of healthcare and in your outcomes. So looking at, for example, what is it that they're doing in New Zealand with the Maori population and mental health that we can learn from, or the First Nations in Canada. So it's about looking at, not being siloed within our own borders around trying to find solutions by ourselves, but actually opening our minds and going beyond our geographical borders to look at some of the potential solutions, some of the common solutions to some of the common challenges that we have around these concepts.
I'm again drawn to, and it's giving me flashbacks of being in the civil service, I'm afraid. You talked about the group. You talked about convening a group to look at, to examine, to basically, I suppose, dissect. Now, this sounds very much like review. It sounds very much like take a long landscape look at what is actually going on. But what does that mean in practice? Where do you go after you've looked? Where do you go after you've examined, after you have actually taken a look at how the land lies?
Yeah, so this isn't about it being a review. This is about it being education. So it's bringing together the intelligence, the evidence base globally, and making sure that we then influence organizations, governments, leaders.
How?
By putting out very clear recommendations for change, by influencing policy, by working with them to acknowledge that these issues are in fact real issues to tackle, and to put in place interventions which are then co-produced with these experts in order to make sure that we can really focus on these issues at the ground level. And so it's important that we have that constant drumbeat of these issues, these challenges, the data, the recommendations. And very often people say, this may be another report. We've heard this all before. But the challenge there is, if we stop talking about it, people will forget about it. So there needs to be a balance between, yes, we need to constantly remind people of the challenge we had, but we shouldn't be here just to highlight the scale of the challenge, but to come up with some very practical solutions as well.
Is there anything similar in terms of mental health care and that as an approach? It seems you're using the drip, 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 constant reference to it to keep it in the consciousness and to move it towards change. Is there anything similar in your field?
Yeah, definitely. And actually, when I was hearing that spoken about experts who then make recommendations and the world becomes a brighter place, I'm not sure it happens that way. I mean, I can remember in mental health when, after lots of deaths in the mental health system, we decided there was going to be race, equity, and cultural capability. And it was a whole drive. And definitely people like Patrick were probably around pushing for that change. Nothing happened. A new government came in, decided they didn't want to do race equity and cultural capability in the NHS. And then we went no health without mental health. We still haven't achieved that. And it's taken people with lived experience and others to challenge the system again, provide that evidence so that we've now got PCREF, Patient and Carers Race Equity Framework. Now, if we don't do anything with that, I'm sure in another 10 years' time, we'll come up with another agenda that people have recommended. I think sometimes we don't want to address the elephant in the room. If we have a fair society that is not based on institutional and systematic racism, some of those social determinants wouldn't keep driving people to our health system. So if we had better housing, better education, employment, and opportunities for people, we wouldn't keep putting a plaster on the problem that we create as a society. When I think about Haringey, people in my borough die 10 years earlier just because they live in the east of the borough versus living in the west of the borough. We've got to address our systematic racism that means that opportunities are not there for the same communities. Yes, we can have reports, but a change of government means that that report will be thrown out of the window, another agenda come along, and we're still no further forward in really addressing the problems that are in our society.
I love the emphasis on the addressing the cause of the effects. How effective is your messaging at the moment in pushing that point?
I think there's been quite a few things in the world that have helped the message. Yeah. So obviously we had a pandemic where it was obvious that the inequalities that we'd all been speaking about for many years were actually killing people in our community. The numbers of deaths that happened in the Black community and other poor communities. Then we had George Floyd, which was just such a shame that we needed somebody in America to die when so many people in our own community right here in the UK have died at the hands of the police and others. So I think there's definitely more of a movement, more people listening. And we've got to take advantage of that window opportunity when people are actually listening. So in the work that we do, we bring a lot of people's stories about those injustices, but also how they've overcome them. Because the other thing to say about weathering and sufferation is it also makes us resilient people, which is why we are still here surviving the sufferation that we have experienced over the last 50 or more years in this country, a country that we have aided in building to what it is today. So I think there's definitely a change, but it's about that momentum. It's about us working together with some of these experts because they can write reports, but community groups and others can speak that report in real life terms so that we start to understand what impact it is having on our communities.
And just a point on that, which is absolutely right, not to produce these reports or recommendations without the community.
Yeah.
The community must be at the heart of that, and stakeholder groups. In fact, I think, Patrick, you're on our stakeholder engagement group within the Observatory, so we don't make any decision within the Race and Health Observatory without it going through the stakeholder engagement group. That includes what we focus on, how we focus on it, and who focuses on it.
So that kind of suggests that, and it goes back to what we said in the first episodes, because we got some people who are different, like yourself, who are now heading up this race observatory, your behaviors and your practices are different from those who were there before. But basically before, they just looked at reports and seemed to tick box,
Well, it goes back to your point around previously we haven't had the change and the shifting of the dial on this agenda that we needed. And that was partly because people's moral compass wasn't pointing in the right direction. They were not actually naming racism as the cause of the inequalities that we see. And now what we're now seeing is a slight shift in that direction. But that doesn't mean we need to sit back.
Yeah.
We still need to make sure that we actually roll up our sleeves and really focus on this whilst we've got that opportunity.
Absolutely.
And Patrick, I'm sorry to put this one on you, but you used to be a Labour council, right?
Yeah.
So I'm not holding you responsible for everything the Labour Party sits, right? And I know you're not a Labour council at the moment. Yeah. But what I wanted to ask you, so we've got a new government now. They're talking big talk about the NHS. They don't really do race equality or race at all, do they? And can we be confident that they're not going to impact the changes that we've seen post the pandemic?
I think probably this new government will be better on race than the last government of the last 10, 12 years. As Lynette said, when the coalition government came to power, they dismantled a lot of the measures about implementing and challenging race equality. They literally halved the budget of the Equality and Rights Commission, gave them less powers, told them not to do things under certain leadership. That needs to change. So I think they was doing much better than last government, but it's a low bar. And it's a very low bar anyway. So we have to have a higher bar around some of the key things that we know already from, over the last 20, 30 years, there have been a number of major reports on health disparities, on criminal justice, on housing, on fostering, on, you name it, any sector. And the government said that the new government have brought back within the Cabinet Office, the race equality unit, which is meant to be coordinating some of this stuff. So let's see what happens there. I hope that the Equality and Human Rights Commission is brave enough and big enough and bold enough to do some stuff. But personally needs a change in leadership. Some of the governors, some of the board members there have a post-racial view of Britain, and that needs to change. And then in terms of the NHS policy, nothing's come out yet. I mean, there are existing strategies within NHS England about tackling racism, discrimination, etc., which Res Observatory has been holding their feet to the fire. But the question is, with the new 10-year plan, it's good to build in race equity. It's not having a 10-year strategy where we're talking about bringing care close to home, digitisation, and bringing a focus more on primary care and prevention without acknowledging racism. Otherwise, we'll be back to square one again.
And be building it into the new...
Precisely. And then it's added on, and then we all of us have to go to the same old meetings and say, what can I include it? This is the opportunity to make it proof right now.
Yeah.
Literally.
I'm intrigued, Patrick, your view on the healthy migrant effect, as it's called, and that is those who have grown up abroad, then coming here, seem more resilient, seem more resistant to racism and the adverse effect it has on health. I put myself in this as a case in point that when my mum and dad came here in the 60s, they were full of life, vivacious and quite resilient to the racism because they came here in good health, and they were able to pass that on to me because of their resilience by their life teachings. You are going to have to work 10 times harder because you are black. You are in a system that is built against you. What is your view, as I say, on the healthy migrant effect? Do you think there is such a thing?
I'm not quite sure what you mean by the healthy migrant, but the only thing I know or aware of, people may have come from that generation or other parts of Africa or something, but they still experience racism. The difference is they internalize it. To me, there's a very strong correlation, and I'd like to be proved wrong, between the increasing number of or elders or even young people, even people in their 40s now, getting dementia, Alzheimer. They've internalized the racism in such a, I think the young people today are a lot accepts it. There's a saying as it is. But of a certain generation, we just internalized it. I mean, it's only just been the last 10 decade or so that my parents started telling me what was happening to them back in the 60s. And the reason why, and this applies to all migrant communities, all migrant families, no matter where they come from, is they want to create a safe environment for their children. That's what they're going to say to their children. Okay, they might say to you, work twice as hard, dumping, but they won't go into the nature of the racism they experience at work or on the public highway or shopping. They kept that to themselves because they wanted to create a safe space for the children. I think it's a bit different now because I think parents now are telling children this is the situation, this is how it rolls, basically. So it's slightly different. But back in those days, they wanted, and also they had this kind of market view of Britain that the mother country will be there for them, and I realised mother doesn't care, but then mother's actually kicking us out. Mother doesn't like us anymore. Mother's sends pulling in the foster care home. That's what mothers do to us. So there's a change in mindset around identities and different types of the way that we see belonging, and also different migrant communities came with different expectations. You know what I mean? And different how they saw the plans of living here and etc. So I think it's different. So I'm not quite sure. The only thing that studies have been done on is when people come to a different country, and how many people will be labelled with schizophrenia, and often it's estimated that if you come to a new country, the level of schizophrenia may be higher or whatever it is. But actually, if you look at the level of schizophrenia or the labeling of schizophrenia within the second, third generation, why is it 4 times higher than someone who's come from a different country? But it's higher if you're born here and raised here, and it goes back to that point of racism, sufferation, etc.
And lack of role models, lack of seeing possibilities. Those who come from other places, they're seeing black people in places of position and power, so they know that what they're seeing here isn't reality. Whereas those who are born into this, and this is all they see, that must be incredibly demoralizing and stops you from ever achieve
my personal role models. And still not right.
And you go all over the world, so you get opportunities to see a lot of things. Where lots of young people are here today, they might not get those opportunities, and it has a negative feedback.
That's why when Black History Month was introduced in Britain in 1997, that was one of the main reasons why it's brought in, because it's about identity, self, and the misinformation given that black people don't contribute to anything at all. Or like we're lucky that you still got a shirt on your back. You should be grateful to Britain. Oh no, we actually contribute to Britain. We've actually been here 2,000 years. We've actually done a lot of stuff, but we're not being recognised. We've been airbrushed out of history. That's why it's important.
Just picking up on a point which you said, again, bringing myself in as an example, my mum and dad always contextualised their "you need to work 10 times harder" by examples of what they were going through and what they lived through on a day-to-day basis. They would tell me nightmarish scenarios of they turn up for an interview, and because in those days it was all done over the phone, and my mum, quote unquote, used to speaky spokey, she'd turn up for the interview and be told, "Oh, sorry, that vacancy's gone." She would have loads of stories like that. Similarly with my dad. So to say that those experiences weren't shared, I'm just saying myself, those experiences were definitely shared in our household. Again, it contextualized what my mum and dad were saying about working 10 times harder. But I'm intrigued. Am I making this concept up in terms of the healthy migrant effect? I mean, I want to put that to you, Habib. Is there such thing as a healthy migrant effect in that those coming from abroad are more resilient, more stronger because they're not actually weathered, they're not actually broken down, they're not eroded by racism?
Well, there is the point that they are coming from abroad. It means that they haven't been in this country for all of their lifespan, which means that they haven't been exposed to racism for all their lifespan. So their exposure to racism will be less because of that very fact. But your point around people that are born in this country and see, for example, the lack of representation at senior levels in the workplace, for example, and not and not having a sense of belonging is what you say, Patrick. Not belonging to this country and not belonging to the country of their forefathers and parents. So that itself will have an impact for those that are born in this country, the second generation as well. So it's a complicated picture. There are various kind of variables to take into consideration when we look at this, and that's why there isn't a clear solution that you could say actually do this and that will solve everything, because it takes and therefore it takes various agencies, parts of society to actually come together to tackle this in a kind of cumulative way.
Can I add to that as well? Because I'm just thinking about the borough that I work in. So I think that what's happened probably over the last 20 or so years, I mean, migrants to this country always end up in the poorest parts of our country, for a start. And I think what's happened is other migrants have gone before them, understood the challenges, and there is a lot of community support. So there are a lot of people trying to educate the new migrants on what you do. And I think that's probably aided some of those communities that have come over in the last 20 years to be able to navigate, create their own community support systems. When I think about the Somalian community in Haringey, and how they've come together to support each other, and particularly their young people, who, because their parents don't have any understanding about the racism in this country, and then how to talk to the younger people. I think that we've all helped each other to settle in this country, because often we're living in the same deprived poor areas that we've always lived in for like 30 or 40 years. So hopefully the community has supported each other to make each other more resilient.
Brilliant response. And again, I think that's almost the perfect way to end this episode.
Positively this time.
We're ending on the positive, but again, it's the positive message really comes from within the community that we've supported, even though new migrants who are living here. Our experience from the days of the Windrush is helping those who are settling here today. And we saw by those right-wing riots recently that they're still experiencing some of what we experienced, but not to the degree that we experience it. I mean, again, it's a difficult episode. We're talking about difficult issues, but the best thing is that we are now recognizing that the system is starting to acknowledge some of those. We're starting to better understand those issues because now we understand how those social determinants play out, but it's good that the system is starting to understand it. And we spoke about the Marmot report here. That's Sir Michael Marmot, is it? All right. And for those who don't know, in many ways, Marmot now talking about race and adding race to his reports is not dissimilar to Baroness Casey adding policing when she was asked to have a look at misogyny and sexism within the police force. And what it's really saying is that the statistics about our experiences of racism in this system are worse than they used to be, and that they're so obvious now that everybody is starting to see it. So what we have to hope is that the system actually deals with it and addresses it. And what we need to say to our black brothers out there is we need to test and push the system. And if we're just sitting at home complaining to each other, we're not testing and pushing the system. Get up, get out, and get in their faces. And let's demand, and let's tell them, when we go to our doctors, we tell them what Habib said, what we can expect. And we should demand a first-class treatment. We mustn't accept second best. And in closing, I mean, I really want to thank our guests, right? You've been amazing. I think that you brought up issues and aspects of the debate and the discussion that we didn't know about. I'm sure our listeners would have learned those. And again, it's really heartening to know that we have people out there working in a professional capacity and also an advocacy capacity to hold the system to account, that actually knows what's happening in the system as well as knows what's happening within our community, and they're trying to address that and make difference. So again, I say to people in our community, support our champions and help them to be champions by turning up and getting involved and participating in this dialogue of equals, and in participating, getting the system to be the kind of system that people
That we want.
like us need and want. Thank you.
Take a step, go, get checked. Want the best for you, no less. Stubborn head, make it make sense. NHS before it goes left. Me and my unks had a dialogue of equals. We're tired of all our people dying before they seem to. Silence don't make you peaceful. So many open wounds, don't even know how we'll heal all. But this is food for thought of a meal. It might be a free course. You know the usual 9 nights and funerals, high and by at the graveside like time is recoupable. Ignore the treatable symptoms, these will cause a domino effect. You won't make it home to the loony board. Take a step, go, get checked. Want the best for you, no less. Stubborn head, make it make sense. NHS before it goes left.
Any information provided on our podcast series is for educational purposes only and does not substitute for professional medical advice. We advise listeners to consult a medical professional or healthcare provider if they seek medical advice, diagnosis, or treatment. We value different opinions and experiences in our program, and any information shared by our guests should be seen as their personal opinion. We have guests who are medical practitioners, but we do not have a medical doctor on our production team. We've added extra information from reputable sources on our website if you want to inform yourself further. We strongly advocate for everyone taking responsibility to inform ourselves about our health. We cannot be liable for risk or issues associated with using information discussed during this program.